Hi, this is the answer for question 9. Describe effective communication strategies for gathering information, educating patients, and the importance of applying them. When you meet with a patient, you have to gather so much different information. And the information that you're gathering is important because it's going to basically put the plan together for what the visit is, what you're going to do to treat them, and everything in between that. So when you're gathering information, because there's so many different things that you're getting at that point. There's a couple different things that you can do. You can either do an algorithm, which is basically taking one question and having a plan for each of their answers, and a question and having a question depending on their answer. So like if you ask the patient if their ear hurts, so and this is the example from our textbook of A Practical Guide to Therapeutic Communication for Health Professionals. This is the example on page 53. So does your ear still hurt? Yes. Okay. Is it still the same ear? It's both. Or yes. Is it better or worse? Worse. Have you finished your medication? No. At what dose did you stop? So there's a step for each question that you're answering, and there's a question to go with the answer that they said. So that is one way, and a very effective way, because then at that point you're just figuring out, okay, this was the main problem. What did you do to get to the point that you are now? Another thing is you can use acronyms. So like in the book it says MD visit. What kind of medications are you on? Which is very important because you need to know what medications that patient is on. So what medications are you on? What are you eating on the daily basis? And so forth. And then visits. Have you visited with another physician or been in an emergency department recently? That is huge, because if you've been in an emergency department and you're being seen for something that you were in the emergency department for, they can gather that information and figure out what your diagnosis in the ER was, and figure out, sorry for the dinging, I'm getting text messages on my laptop. But you can basically take the diagnosis from the hospital, see if that's still what's going on, or if you need to do further testing. Injuries. Have you had any injury? So there's ways that using the acronyms is very helpful, because it answers all the questions that you really do need to know. Like the MD visit does for sure. So that is one way to really gather the information. Now, when you're educating patients to gather the information that you need for the patient, like to educate, is one, you need to know how they learn the best. So do they learn better by you talking to them, or do they learn better by watching a video, or do they learn better by doing what you're trying to tell them? So you gather all that information and you apply it. It's important. It's very, very important to apply it the way that they learn the best, and making sure to clarify what they're learning, because if they go home and they're diabetic and they don't understand how to check glucose levels and what their glucose level needs to be at, then they can go in diabetic coma. Like, so many different things could happen. So making sure that you understand how they learn, that you have all the information, is just so important, because it's basically their life on the line. And you just need to make sure that they understand everything, and whether that's meaning you go over the same thing 5 times and explain it in different ways, or you are just giving them a bunch of different ways of learning how to do it. So you're showing them, you're reading them, you're showing them a video, you're lecturing them. There's so many different ways that they can learn, and you need to find the best ways to make sure that they are getting all the information they need and going to treat themselves the right way.